My name is Stuart Morgan from Wiltshire in the UK. I'm 50 years old and last year I was diagnosed with prostate cancer. The main reason for me making this film is that last year when I was diagnosed, I searched on the internet like probably most people do, and I was struggling to find out too much information about people that had had prostate cancer of a similar age to me. Most of the stuff I was looking at online concerned people that were perhaps in their 60s, 70s and older, and I wanted to make a film that maybe explained the situation that I was in and the process I went through in my late 40s, from the time I was diagnosed right through to after the treatment. So you've been diagnosed with prostate cancer. It's horrible. Whichever way you wrap it up, I certainly didn't find it easy to accept when I had it. I thought I was either too young, fit and healthy, no symptoms. I thought, why me? I'm sure everyone else that receives the same diagnosis must feel the same at some point. But in reality, you've got to look at the treatments that are available for prostate cancer and how good they are. And really, you don't need to let prostate cancer ruin or control your day-to-day life. So how did I come to find out I had prostate cancer? Well, in my case, it was picked up at one of these well-man health assessments. You know, the type of thing that you attend and they tell you whether you're too fat, too thin, your cholesterol's too high, your blood pressure's too high. Come to think of it, they told me most of that. But one of the tests was a blood test that involved obviously checking my PSA. And I had my first test when I was 44 years old, and it did show a slightly elevated level of PSA at that point. We did have some family history. Unfortunately, I'd lost one of my uncles to prostate cancer. So it was in the back of my mind that there may be something that I have to keep an eye on going forwards. But I certainly didn't expect at 49 for it to be troubling me at that age. A couple of years later, when I was 46, I had another test, repeat one, and the PSA was gone up slightly, but again, still at levels where we thought it was best just to monitor things and not get too alarmed. So for me, in autumn of last year, when I had another test, it didn't really surprise me that my PSA had gone up. It had gone up to 3.8, and I thought I was just going to stay on the same monitoring system and just keep an eye on it. However, my GP and Bupa both thought it was prudent to have an MRI scan because the levels were rising at a rate which is above what they should be, and it was just going to be precaution really for me to have a test to make sure there's nothing nasty there. So it was early October when I popped into my local hospital for my MRI, which the process itself is very straightforward. It's painless. It takes about 45 minutes. You go into one of those tubes. You hear a lot of sort of dig, 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 dig as the scanning goes on around the area of the prostate. And then you sit back and you have to wait 10 days, 14 days to get the results back. Now, I'll be honest, in the back of my mind, I didn't think there was going to be anything on my MRI that should concern me. I didn't feel any unwell. I didn't have any symptoms. I basically was thinking that it's just going to be a procedure that I'm going to go through to show there's nothing there. So I was quite surprised when the telephone rang and said, "Oh, Mr. Morgan, can you come in and see the urologist for a quick appointment just to discuss your MRI?" That appointment was duly made and I popped in to see the urologist, and he was there to discuss with me the results of my MRI and to give me a physical prostate examination. Now, to anyone that hasn't or is worried about a prostate examination, you needn't be. Men tend to fear the thing because they realise it's the rubber glove, and yes, it's the finger or thumb up the bum. But the bottom line is they have to be able to examine your prostate, and the only way they can do that is basically inserting their finger up your rectum with a rubber glove, and they will feel your prostate to feel if there's anything enlarged or any irregular shapes in there. So guys, you just need to get over it, accept it. It could well save your life. So after my physical prostate examination, I had to go in and speak to the consultant about the results of the MRI and then the examination itself. And he basically said to me that he felt a slight level of firmness in one lobe of my prostate, which didn't unduly worry him at the time, but he said it was when he combined that information with what he was looking at on the MRI, he was slightly concerned there was something there that needs looking at. And that consisted of a shadow. He saw a shadow on the MRI, and he said that I would be very unlucky at my age to have prostate cancer. But he basically drew a diagram on a flip chart, is the best way of explaining it. And he drew me a diagram of a nice, healthy-looking prostate. And then he drew another diagram of if somebody did have prostate cancer, it may look like this. And when you compared my MRI with the diagram that he just drew on the flip chart, they look pretty similar. So at that point, I think it was the first time that I realised that there may be a real problem that I have to address. But it still didn't really sink in because I thought it could be something else. And in fact, they did confirm that it is not definitely prostate cancer. Unfortunately, the only way you can tell for sure if you've got a prostate cancer issue is to probably have a biopsy. And I'd heard about biopsies. I heard a few friends of mine had been unfortunate enough to have them. And the thought of having basically chunks taken out of your prostate, which is what it is, didn't fill me full of joy, I'll be honest. But it was the only way to establish if there was anything else serious that needed looking at. Now, a biopsy, to anyone that doesn't know, is a situation where they take samples from your prostate. They normally, in my case, they took 12 samples and they send them off, and they can tell if any of those come back as cancerous. And they basically score you depending on how many of the 12 come back as clear or how many of them come back as showing that they've got cancer. Now, the biopsy itself, there's no way of wrapping this one up. It's not a very nice situation to be in. It's not very comfortable. It feels indignified at the time, because the best way of describing it is you walk into the room where they're going to do the biopsy, and there's an instrument there which is connected to an ultrasound, which looks something probably akin to what you'd expect to see in maybe an Ann Summers store, except for the top opens out with these weird cameras and cutting tools. And the purpose is, obviously, they go in, and it's almost like an apple coring process is the best way of describing it, and they take very small samples from all over your prostate. It's pretty uncomfortable, to be honest with you. It started okay. The first 4 were fine for me, and then they progressively, I think, as your pain receptors kick in, they get more and more uncomfortable, and by the time you get to 8, 9, 10 and beyond, you are just wishing it's over. You won't want to do much for a couple of days afterwards, and there's you bleed from a few orifices, shall we say, and some of those symptoms in fact stay for 2 to 3 weeks. So certainly when you go to wee, or any body fluids that you can think of are certainly carrying elements of congealed blood. So don't be alarmed if you see that. It's perfectly normal. It just has to flush through your system, and then you sit back and wait for 2 or 3 weeks for your results to come in. Now, I suppose I'm the same as most other people, that you get slightly apprehensive waiting the results to come back. But deep down, I still didn't think there was anything wrong with me. I thought that there's probably another cause for it. It won't be cancer, and you'd rather kind of cling on to that hope. But certainly when the phone rings a couple of weeks later and they say, Mr. Morgan, we've got your biopsy results. And I was hoping they were just going to tell me on the phone, no further action, and it was something else. But of course, it didn't happen that way. And the phone rang, and they said, Mr. Morgan, you need to come in and see the urologist again to discuss the results. At which point I said, oh, surely you can discuss these over the phone with me to put my mind at rest. And I had a little inkling that when they said to me, no, Mr. Morgan, we don't discuss this over the phone, which I can understand. The only way is to pop in and discuss it. So, and they said, by the way, could you bring somebody with you, a wife or a partner? And we need to discuss the outcome of your results. So I remember the day I got diagnosed really well, December the 12th, 2017. It's funny how those days stick in your mind, but there we go. I popped into my local hospital to see the urologist, and as soon as I walked in the door, I thought, I'm in trouble. The urologist was sat in front of me, nice guy. What I think was a security guard was just to his left, and to his right-hand side, I glanced over and I could see a clinical nurse with the name Macmillan on her badge. And as soon as I saw the word Macmillan, I thought, I've got cancer. In fact, I think the first words I said is, that'll be cancer then, will it? Do come in and take a seat, Mr. Morgan, he said. It's fair to say this isn't going to be the best Christmas present you've ever received, but I do need to confirm that your biopsy results have come back and shown that you have got prostate cancer. And at that time, I remember taking a deep breath and thinking, well, this is realisation. This is real now. I've got something that needs addressing, but it didn't really faze me that much. I mean, to be honest with you, I thought, well, okay, I've confirmed what I kind of suspected or what I thought may be there. It's confirmed that maybe my family history has come into play, and genetically I've got cancer at a young age. But I thought, well, I can deal with this, and really just want to get on and find out how bad it is. And in my case, it wasn't too bad. I was kind of given some reassuring information that it was still at an early stage, and more importantly, the prostate cancer hadn't broken out of the prostate. It hadn't changed its state, because if it had, then obviously the situation is a lot worse, and your options for treatment have to change quite drastically. So whilst this contained within the prostate, I was told that it was reasonably safe. If you could get such a phrase. But the bottom line was I had 25% cancerous cells in the left-hand side of my prostate and 3% in my right-hand side. The prostate is divided into 2 halves, and they generally test both halves separately. So 25 and 3, and it basically gave me a Gleason score, which is the grading of what they use to basically assess the level of development of the cancer. And I had a Gleason score of 6. And that to me didn't mean too much at the time. And obviously, you know you're then going to be in a situation where you're going to go home and get on the internet and start researching things. But I spoke to the urologist at depth about what the options were, and because I was quite young, in fact, the one thing that I continually heard throughout the whole process was, "You're very unlucky to be here, Mr. Morgan, at your age." And I didn't feel very lucky at the time because I basically just said, well, I am here. And but the statistics say at 49 years old, you're pretty unusual to be in a situation where you've got prostate cancer and you have to deal with it. So we had to look at the options available for treatment. Now, in my particular case, I was given 3 options for possible treatment. Well, there is always a 4th option, but the 4th option was to do nothing, and that would result ultimately in me being dead. So that's one option I crossed off fairly quickly. So the 3 that were viable that I had open to me were brachytherapy, which is sometimes called seeding, where they plant little radioactive seeds into your prostate, very similar to the operation in a biopsy, in reverse, in effect, where they're putting things in instead of taking chunks out. Radiotherapy or surgery. So you're faced with the 3 options, and the NHS aren't really there to give you any advice over to which way you should go. What they can do is furnish you with the information about what the processes involve, what the recuperation periods are, but they really encourage you to go away and, in my case, use the Christmas period to discuss the options with your family, hopefully speak to other people that have maybe been in the situation and had some of those treatments. They're excellent. They put you in contact with a few local cancer care support groups where you can, in fact, do this. And, of course, you turn to the internet and you Google and have a look online, and the view is that you should really sort of come back after a couple of months, in my case in January, and say, this is the considerations I've made and this is the option I'd like to take for you to treat my cancer. And that's pretty much how it happens, I think, with most people that I've spoken to. So it's difficult to explain, really, when it comes to choosing an option of treatment for cancer, because none of them are very nice. You don't look forward to any one of them, and the urologist said to me that all of them are pretty bad in the scale of what you wouldn't wish upon someone else. But anyway, I personally, everyone's different. I kind of thought that if I was slightly older, maybe in 70s or mid-70s, I maybe would have opted for the seeds because it seemed a good option for delaying things for a short period of time. But I needed to know that the cancer was out of me. So for me, the brachytherapy or the seeding was not an option that sat well with me, but it may be different for obviously other people. So you've got to really make your own mind up in what's right for you. So I then turned to radiotherapy, and I spoke to a few people obviously before that had radiotherapy, and they said it really does beat your body up quite badly, and I think the recuperation period will be longer. And the impracticalities, I mean, not that you should think about this, but 7 weeks every day travelling to Oxford or to Bristol, it just seemed to be that it was hugely invasive, longest recuperation time. And to be honest with you, I wanted to try and keep radiotherapy up my sleeve in case I needed it later on in life, maybe for this cancer or another type of cancer. So rightly or wrongly, I wanted to keep radiotherapy kind of there to use again if I needed it later. So it came down to option 3, which was surgery. And the risks involved in surgery are very real. The one thing I will say is when you look online and they give you lots of statistics, it's very easy to get overwhelmed by them because they don't make very good reading. But I did have to take on board that I realised that those stats are basically made up of people that are generally a lot older than me. And so when you read about obviously erectile dysfunction problems, bladder problems, etc., you've got to bear in mind that a huge portion of the statistics are made up from people that are in their mid-70s or 80s that may well be suffering from some of those early onsets of those things anyway. So they may already have the early issues with bladder, erectile dysfunction, etc. And as far as I'm aware, there isn't any stats available for people of my age group, and I really wanted a second opinion. So I searched online for someone that might be able to help me confirm that the decision I was about to make was in fact the right one. 2 names, prominent names in their field, came to light. Roger Kirby in London, expert in his field, and more local to me in Bristol was a guy called Anthony Kaparis. Now, Anthony works out of Bristol Urology Associates in Clifton in Bristol, but he also works in the NHS as well. So he operates both in the private and the public sector. The NHS up to that point have been absolutely brilliant, and they still are. In fact, the treatment that you get from the NHS is pretty identical to what you get in the private sector. The hospitals are the same. The surgeon is most likely to be the same. There's very, very little difference. But for me, I thought, well, I've paid Bupa for all of these years anyway. Why not use it? So middle of January, my wife and I sat in front of Anthony, and straight away I knew that he was the right guy for the job, to give me the right advice and the confirmation I was looking for that surgery was the best option for me. He wasn't frightened to give me a straight answer, and I really did want someone just to say, look, you're doing the right thing. And to be honest with you, I think I put a direct question to him and said, look, if you had a brother who was 49 years old with prostate cancer and you looked at my records and you were in that situation, would you say surgery was the right option? And in my case, he confirmed, yes, that was the situation, that the risks were very real, but they were risks worth taking. And for me, it was just a peace of mind thing that I just wanted the cancer gone. I wanted the prostate out. I wanted the whole cancer removed. And that to me gave me the best peace of mind that going forward, that would give me the least impact on my day-to-day life. It's fair to say that one of the key concerns for me was the long-term effects after the operation. These revolve around two main areas. Am I going to get proper use of my bladder? And is my penis going to work? In fact, I think I asked that question 3 times. Is my penis going to work? Is my penis going to work? And by the way, is my penis going to work? Because it's a key worry for anyone, I'm sure, of any age, but especially my age. And I got some level of reassurance that whilst the risks are very real, and I had to accept the fact that when they go in for the operation, if there's cancer around those nerves that control those key functions, they're going to have to come out. It still didn't dissuade me that surgery was the right option for me. My operation was booked for the 25th of February 2018, and then I went through the process of preparing for that operation, both mentally and physically. When it comes to physically preparing for the operation, I've got one key piece of advice that I'd like to recommend. Learn how to do pelvic floor exercises, learn how to do them properly, and do them as much as you possibly can in the lead up to your operation. It really will pay you a large benefit post-operation in regaining your continence and allowing your bladder to have the best chance of retaining fluid. Part of your pre-op procedure will be to go and attend a session about catheter training. I don't envy anyone who has to wear a catheter. I personally hated the experience. It's not very pleasant, but the catheter tube is basically put in during the operation and you keep it in there for probably 10 days or so, 2 weeks maybe after the operation. For me, it was one of the least enjoyable experiences of the whole process. I hated wearing a catheter and I couldn't wait to get it out. So mine was removed 9 days after the operation, which was for me a real benchmark of when I could start my proper recovery. Preparing mentally for the operation was quite straightforward. However, preparing to accept the fact you've got prostate cancer is not so easy. I found the diagnosis pretty straightforward. I coped with it pretty well, but don't be embarrassed or ashamed if you have a wobble. I had a couple. I was just 2 weeks after I was diagnosed. I was sat in the settee reading about cancer, researching about cancer, and just had a massive welling up and an outpouring of grief. And I spent 10 or 15 minutes bawling my eyes out, thinking, crikey, what's going on? My wife came in and we sort of sat there and we cried some more. And then I brushed myself down and thought, what brought that on? And we moved on. And I know telling my mother was particularly challenging for me. My mum's brother had died of prostate cancer at a fairly young age, unfortunately. So I knew that was going to be quite raw. So that was a tricky one. But other than that, I'm sure everyone's different, but don't be surprised and certainly don't be at all ashamed of the fact if you have the odd wobble. All I can say really is, I personally made a decision that I wasn't going to tell anybody or as few people as I possibly could. In fact, I didn't tell my family I had prostate cancer until after the operation. I didn't really want sympathy and endless phone calls asking how you are every 5 minutes, because that wouldn't have really helped. And I just thought the fewer people know, the better. And I didn't really want to burden anyone else with the decision or the awkwardness around me having prostate cancer and going in for an operation. So my idea was to go in, have the operation, recuperate, and then talk to anyone about it and everyone about it afterwards, which is how it turned out. A couple of days before my operation, while I was doing some last minute research online, up popped the excellent Stephen Fry video on YouTube. Stephen had obviously gone through a similar procedure to myself and had been diagnosed with prostate cancer, and he made a really excellent video explaining what had happened to him and everything really that kind of I'd been through. And I watched it and thought what an excellent video it was, and hopefully it'll be great to get exposure about prostate cancer. And initially I was going to tweet him and I was going to say, thanks very much, you've saved me a job. You've done a great job there. And I know Stephen said he was worried at 61, I think he was, that he'd been diagnosed with prostate cancer. And a little bit of me sat back and thought, well, why is he worried at 61? I mean, I'm 49. Why have I got it? I'm far too young. But Actually, it was Stephen's video online that encouraged me. I said, well, post-operation, irrespective of the result, I was going to sit down in front of a camera like I am now and just explain the process as it happened to me. And hopefully in some way that would help maybe reassure anybody else that's in the same situation. So I'm so glad that he made that video and I'm making this one. Now, when it comes to the operation itself, it's obviously done under general anaesthetic and it's done by a surgeon who's operating a robot. And the robot is extremely accurate and it makes, in my case, 5 small holes in my stomach and a small 2-inch slit just above my belly button. And obviously the relevant tools and cameras, etc., go in and enable them to carry out the operation to remove the prostate. You're not really aware of anything until you come round. And at that stage, you're on morphine initially, so the pain is handled intravenously. So you don't really realise how uncomfortable the operation is going to be until 4 to 5 hours after you've come round. The best way of describing it is painful. It's what I call proper pain. I've broken limbs and bits before and thought that was painful, but this was a different kind of pain. I had it explained to me once before I went into the operation that having the operation was like being stabbed in the stomach 5 times with a bread knife and then once up the backside right up to the handle. And I probably think that's not far off the truth. It certainly was an internal pain that is prevalent and is there and needs painkillers for probably a week after the operation, and then from weeks 2 to 3, 4 and onwards it gets noticeably less and easier to manage. You are told that you should not basically in any shape or form go lifting any heavy weights or strain anything, because obviously you could do some damage internally. I think the phrase was try not to lift anything heavier than a kettle for the first 6 weeks, which is actually quite tricky. But it's definitely worth bearing in mind that there's no need to be a pain hero. Take the drugs they give you, manage the pain, and don't try and be ahead of the game or win any prizes for going back to work sooner. I personally thought, well, I'm going to, if they tell me 8 weeks, I'm going to be back to work in 5. In reality, it's difficult to do anything manageable for 5 weeks. Certainly by week 6 and 7, I was in a situation where I could do some light work and start going back, but no heavy lifting, etc., for at least the first 8 to 9 weeks for me, and that was about right. So here I am, some 7 months after the operation, and my operation was considered a great success. I'm confident now it's the right form of treatment for me. I'm happy with how everything's turned out. I was told post-operation that I should expect maybe 80 to 85% functionality from bladder, etc., etc. And that's pretty much where I'm at now, so I'm very pleased with the outcome. Would I have any advice to anybody else going forward? It goes without saying that any man aged mid-40s, if you've got family history of prostate cancer, go and get checked. Certainly any man over the age of 50 needs to basically get down to their GP or their prostate clinic and have a test. I mean, it's a simple blood test. It's a physical prostate examination, which is not as bad as everyone makes out, so don't worry too much about that. It's just one of those things where you've got to get over it and get tests and be aware of it, because catching prostate cancer early is much more important than anything else. If you leave it, if you think you've got symptoms, you do nothing about it, the situation will only get worse. Some people ask me how I think cancer will affect me in the short term and the long term, and I answer that by saying in the long term, I just don't know. I don't think any of us know, so I'm just going to take that one day by day. In the short term, I would ask, has cancer affected me psychologically? I've got to say yes, most definitely. I think in some ways it's difficult to accept that it's taken me to get prostate cancer to appreciate and probably put the true value on time and how important time is to us all. We're certainly not going to get it back, so really I do cherish the time spent with friends and family or just doing the things that we enjoy doing. I'm lucky in the respect that I enjoy what I do for a career. I love filming, I love editing, and I want to carry on doing that, and hopefully prostate cancer won't interfere with that going forward. So to anyone else that may be in the same situation as me and potentially going through treatment, I would say this: be strong, be positive. By all means give the cancer the respect that it's due, but don't let the fear of prostate cancer overwhelm you. Take some solace in the fact that many of us, after we've had the treatment, will carry on our lives exactly as we did before we had the cancer. So what I would say is thanks for watching, be positive and stay lucky.